Hi everyone, thanks for listening to my presentations. Today I'll be talking about child neglect and I'll be focusing on medical assessment and reporting aspects of child neglect. I have published several presentations on child abuse. Okay, with that in mind, let's go. Epidemiologically, children under 3 years are most vulnerable. Fatalities are associated with poverty, and religious objections to medical care is left to your jurisdiction to determine. Doctors are obliged to act in the best interest of the children, even if it goes against the beliefs of the parent. But doctors should please be fair, truthful, and not a predetermined judgmental report will give us good reputation. Child neglect is the commonest form of child abuse, and half of the entire cases reported to Child Aid and Services or Child Protective Services are all child neglect. Neglect is simply the failure to act, and that may be causing physical and emotional harm to the child and can even lead to death in certain situations. Examples of child neglect is physical neglect. Physical neglect could include not enough food, not enough clothing, no shelter, or no proper hygiene. It could be supervisory neglect. In that wise, we'll be talking about inadequate supervision at home or playground or outside the home, and the kids are led to stray along the street or even the mall, and that could lead to harm. Road traffic accidents and so many falls, taking poison, taking chemicals, falls everywhere is a sign of supervisory neglect. Emotional neglect. If there's no love or affection or emotional support, and you're not providing psychological care to the child, or you're exposing the child to domestic violence, like I have a separate presentation on spousal abuse or intimate partner violence. No security, or the child is exposed to danger. For example, parents that are doing drugs, all these constitute emotional neglect. Educational neglect. Not enough provision for education. School supplies not being provided, not preventing overnutrition with subsequent medical complications. Because you need to teach the child that you don't supposed to be eating and overeating all the time. Medical neglect. Not taking the child for clinical appointments, failure to provide the prescribed medications. If you don't have the money, contact social welfare. Not seeking medical assistance promptly, i.e. delaying. The child had a fall and the parents are undaunted, just going their own normal way. And dental neglect, not taking the child to see the dentist. Well, so many factors are in place here, maybe no financial support and so on. Just talk to the social welfare and the doctor will help as well. But it's regarded as a neglect. When it comes to child neglect or child abuse, we need to put so many factors into consideration. So I'll look at the risk factors here. Domestic violence. Any history of spousal abuse here? Poverty. Before we labeling this woman as not supplying the good clothing and the good food for this child, how much is he or she or both, how much are they earning? Street drugs. That's a big issue, right? That's why kids are taken away from so many families when the parents jointly are doing drugs they will take the kids away in Western world, believe it. Or when one partner is doing drugs and the other one is clean, the one doing drugs will not be allowed to see the kids again if it's exposed and it becomes a legal matter. I bet you. Inexperienced and young parents, you need encouragement here. No social support, no uncle, no auntie, no grandparents to help in raising the kid. And this is a young woman with the first pregnancy. Imagine a young woman of 17 years or 16 years having 3 kids under a watch, then we're likely going to face this. No medical knowledge of the behavioral nature of the child or the parenting skills generally, just telling about young parents as well. Assessment. Yes, we should be precise on the exact type of neglect that has occurred. But we must ask, is it repeated? Because if this is just occurring for the first time and has never happened before, then no problem. Just advise against it. But it depends on the severity of the neglect anyway. Then, have you seen any obvious harm done already? Then that will determine you not keeping quiet, please. Your assessment of the risk level, risk factors that I've just mentioned, you go over them. State any other types of neglect or abuse that you have noticed. Particularly, sexual abuse is a serious one that must not be kept under the carpet. Are there other children in the family? Are they in danger? Is this child before me in danger? Is the family preparing for changes? Is there any determination whether or not a report to Child Protective Services is warranted? I have to make that determination. What are the clinical features or symptoms that we may likely be faced with here? There is no fixed pattern. Maybe associated with sexual abuse, physical abuse, or psychological abuse. You can notice poor hygiene, poor dressing, frostbite in wintertime, hypothermia in summer, or heat illness in summer. That will point to exposure, no shelter, right? The child is just left alone to wander around like stray human being. Medications or drugs ingestion, that is a sign of no supervision, right? Gunshot inadvertently to the child, that means they didn't protect their, firearms in the house. No emotional attachment. You watch the relationship between the child and the caregiver while under your watch. And absenteeism at school, the school will give you the record, right? And watch this. Failure to thrive. Failure to thrive. When you check the growth chart, you will see that the height, the weight, the length, failure to thrive. Obesity, because the child is just left to eat anything, whether healthy or not, nobody cares. Dental caries, not seen dentist, no toothbrush and toothpaste provided, not attending clinics promptly. All these are features that we may pick while the child is before us. History. You can get your history from teachers, from daycare, caregivers, separate interview with the child. You'll be able to get the true picture. Then, financial status of the family, poverty. Please, before we label that man or woman as neglecting their child or children, let's find out if they themselves are not suffering. Relationship between the child and the caregiver, like I've said just about 1 minute ago, you watch. Is the child afraid? Are they cordial? Are they pretty close or not? The questions could be, can you describe the head of your child? What about his or her personality or his behavior? How about the development? Do you know, have you been following up? Can you remember the last joint family event you had? That is to show if they are cordial. Do you have support? That is to find out if this woman is even having a lot of problem financially. Why has your child missed school? So the child, while on one-on-one interview with the child, you can ask, are you being well fed at home? Why are you missing doctor's appointments? Have you been left at home for a long period of time before and you were by yourself? Have you been prevented from going to school? Are you afraid for your life for any reason or reasons? And if the child tell you yes, please find out and tell me why you've missed medical appointments. Also, exclude criminal history of any adults involved in the family. Prior child aid and services involvement, any domestic abuse that's going on. Is anyone doing drugs in the family? Psychosis, depression in the caregiver. Because someone who cannot look after himself or herself is not expected to look after somebody else properly. Unrealistic expectations and mental retardation. You have to also exclude the following, that is, try to check for possible barriers in the child or caregiver that could have made it difficult for prevention of neglect. In other words, we have to do everything to make sure that before we write it down and label this mother as someone who has neglected her daughter or son, let's find out why is it so? What are the barriers? Some kids are obstinate, they are heady, they will never take instructions. Oppositional deviant disorder is found in some kids. And some women, they didn't have that experience. Some parents, some fathers, they were not raised that way, and so on and so forth. Let's get all those facts. And let's exclude religious belief. Okay? That's a big issue, right? And we refer to social worker for a separate assessment and referral to child aids and services later on. So you are not the only one making this diagnosis. You are building a team to help this child, but the child must be helped. And the report should be filed. Disposition. Are we in need of emergency medical attention here? If that's the answer, the child is not going home with the parents. Is this a case of sexual abuse? If the answer is yes, don't discharge to the parents' place. Or is there a very high risk of danger? If the answer is yes, or you are suspecting that very highly, don't discharge the child, please. And we have to report to CAS or CPS immediately. And we need to find out any psychosocial stressors or medical diseases that could have contributed to this problem. Treatment. Safety of the child, that's the reason why I'm making this presentation, and that is why this is part of the legal roles or duties of medical practitioners. Hospitalization when it is required and necessary, probably to be able to carry out more investigations and get to the bottom of the problem or make a definitive diagnosis, or to help the child out of danger. Education and documentation. If you notice that this is not such a too much serious a problem is what could be redeemed, then educate the parents. And of course, documentation must be properly done. Multidisciplinary team like social workers will be involved and do a very thorough physical examination because I said, be fair, be fair. Based on your interaction, you can make the determination if you need to do some laboratory investigations. That may include, but not limited to, complete blood count with differentials, glucose level, electrolytes, clotting profiles, genital swab microscopy, culture and sensitivity if you are suspecting child abuse and you are ruling out sexually transmitted infections, growth chart, and of course body mass index if your concern is obesity here. The diagnosis is usually made clinically. Yes, clinically from the history and physical examination. Most of the time, you make the diagnosis of child neglect. But if you want to make a definitive diagnosis that child neglect with so, you may carry out certain investigations based on your judgment. What are the differential diagnoses of child neglect? It could be failure to thrive. And that will force me to have a presentation on failure to thrive next. So after watching or listening to this presentation, the next presentation will be failure to thrive, so as not to confuse failure to thrive with child neglect and not to overlook child neglect thinking it is failure to thrive. So with that, I've come to the end of this presentation. It is a must for medical practitioners to report child abuse and child neglect and save the children from unnecessary victimization and dangers. Thanks for listening. Kindly remember to subscribe to my channel and share. I appreciate it.